Hi,
My name is AMRITA. I'm a medical student. What is your name?
I'm Shabuddin.
How old are you?
I'm 24.
Okay, so today I'll be examining your abdomen. Did you have anything or did you eat anything a few hours ago?
No,
Okay, so if it's fine, then let's proceed.
sure.
With a proper hand hygiene, we proceed to the examination of the patient. At first, we lift up the cloth of the patient and then inspect the abdomen for any scar, styria, dilated veins, rashes, etc. We inspect the symmetry and also observe the contour of the umbilicus. Warming our hand and the stethoscope, we auscultate to listen to the vowel sounds before performing percussion. We listen in the all four quadrants: the right upper quadrant, left upper quadrant, left lower quadrant, and the right lower quadrant. We listen to the sound of the iliac artery and femoral artery. Here, everything sounds fine. We lightly percuss the abdomen to access the tympani and dullness. We palpate in the all four quadrants to identify tenderness or increase in resistance. Meanwhile, we observe the patient's facial expression for indication of any tenderness while palpation. After palpating in all the four quadrants, we proceed with percussion. We percuss all over the abdomen to find if there is any asymmetry in the sound of the vowel. Now we proceed to liver examination. We percuss along the midclavicular line to identify the upper and the lower border of the liver. The upper and the lower border is identified by the dullness of the sound of the percussion. We measure the span of the liver dullness between the 2 points, and then we measure using a ruler the upper border and the lower border. We palpate the liver as the patient breathes deeply and try to feel the liver edge. We keep palpating until we can feel the edges properly. Now, making a fist, we tattoo on the body of the patient to examine the border of the liver. We do the same on both the sides of the body and ask the patient if he feels any difference.
Do you feel any difference?
To palpate the spleen, we put a firm pressure on the left upper quadrant of the patient. We ask the patient to tilt a bit so that you can feel the spleen properly. Now we percuss over the anterior border to see if there is any enlargement in the size of the spleen. By standing on the left side of the patient, we try to palpate the left kidney by placing one hand below the patient and one hand above. While the patient breathes in and out, we try to examine the movement of the kidney and assess its location and its size.
Put your hand behind your
Now, we try to feel the aorta and try to estimate its width. With the patient sitting up, we assess for the costovertebral angle tenderness, that is CVAT. Normally, there is no tenderness.